Erectile dysfunction is a common condition that can affect men of all ages, but is more prevalent with increasing age. ED can have a significant impact on quality of life and can be a source of stress and relationship difficulties. Imagine if you could address this issue naturally without relying on medications. In this video, we'll dive into the root causes of erectile dysfunction and unveil effective natural treatments. You'll learn how simple dietary changes and lifestyle tips can transform your sexual health, boosting your confidence and well-being. Causes of erectile dysfunction. Understanding the root causes of erectile dysfunction is crucial to effectively addressing this condition. Here are the primary factors that can contribute to erectile dysfunction. Number 1. High blood pressure. High blood pressure or hypertension can damage blood vessels, reducing blood flow to the penis. This decreased blood flow makes it difficult to achieve or maintain an erection. Studies have shown that managing blood pressure through lifestyle changes and medication can improve ED symptoms. A healthy diet, regular exercise, and stress management are key components in controlling hypertension. Number 2. Cardiovascular disease. Cardiovascular disease, including heart disease, affects the arteries and veins responsible for carrying blood to the penis. Reduced blood flow due to clogged or narrowed blood vessels can lead to ED. Research indicates that improving cardiovascular health through diet, exercise, and medication can significantly impact erectile function. Maintaining a healthy heart is essential for robust sexual health. Number 3. Diabetes. Could your blood sugar levels be affecting your sex life? The connection between diabetes and ED is more significant than you might think. Diabetes, both type 1 and type 2, can cause nerve damage and impaired blood flow, contributing to ED. High blood sugar levels damage blood vessels and nerves, which are crucial for achieving an erection. Maintaining blood sugar levels through diet, exercise, and medication is crucial for managing ED in diabetic individuals. A diet rich in fiber, low in sugar, and regular physical activity can help keep diabetes in check. Before we proceed to the next cause, be sure to hit the subscribe button. Number 4. Obesity. Obesity increases the risk of vascular disease and diabetes, which are major causes of erectile dysfunction. Excess weight can lead to hormonal imbalances and reduced blood flow, both of which contribute to erectile dysfunction. Studies have found that losing weight through a balanced diet and regular exercise can improve erectile function and overall health. A focus on whole foods, portion control, and physical activity is key to achieving a healthy weight. Number 5. High cholesterol. High cholesterol can lead to atherosclerosis, where the arteries become clogged with fatty deposits, reducing blood flow to the penis. Lowering cholesterol levels through diet, exercise, and medication can improve blood flow and reduce ED symptoms. Incorporating heart-healthy foods like fruits, vegetables, and whole grains into your diet can help manage cholesterol levels. Number 6. Hormonal imbalances. Low levels of testosterone or other hormonal imbalances can affect sexual desire and erectile function. Hormone replacement therapy and lifestyle changes can help balance hormones and improve ED. Regular physical activity, a healthy diet, and stress management can support hormonal health and enhance sexual performance. Number 7. Psychological factors. Stress, anxiety, and depression can all interfere with sexual function. Addressing these psychological factors through therapy, stress management techniques, and lifestyle changes can greatly improve ED. Practicing mindfulness, seeking professional help, and engaging in relaxing activities can alleviate psychological stress and enhance sexual health. Number 8. Medications. Some medications can cause or worsen ED as a side effect. Common culprits include certain blood pressure medications, antidepressants, and anti-anxiety drugs. If you suspect your medication is affecting your sexual health, consult with your doctor to explore alternative treatments. Never stop or change medications without professional guidance. Foods to reverse erectile dysfunction. Eating the right foods can significantly impact your sexual health and help combat erectile dysfunction. Let's explore dietary options that can make a difference. Number 1. Watermelon. Watermelon is rich in citrulline, an amino acid that can help improve blood flow and relax blood vessels, similar to how Viagra works. Studies suggest that consuming watermelon can enhance erectile function. Enjoy this refreshing fruit as a snack or in smoothies. Number 2. Pomegranate juice. Can a glass of juice improve your erections? Discover the benefits of pomegranate juice. Pomegranate juice is packed with antioxidants and polyphenols, which can improve blood flow and reduce oxidative stress. Research indicates that regular consumption of pomegranate juice can improve erectile function. Incorporate this delicious juice into your daily routine for optimal benefits. Number 3. Citrus fruits. Citrus fruits like oranges, lemons, and grapefruits are high in vitamin C and flavonoids, which can improve blood flow and reduce inflammation. Studies have shown that these nutrients can help combat ED. Add citrus fruits to your diet for a refreshing and health-boosting snack or juice. Number 4. Beetroot. Beetroots are rich in nitrates, which the body converts into nitric oxide. Nitric oxide is a vasodilator, meaning it relaxes and widens blood vessels, improving blood flow. The nitrates in beetroots help lower blood pressure by relaxing blood vessels. This can reduce the strain on the heart and improve overall cardiovascular health, which is closely linked to erectile function. Beetroots contain antioxidants like betalains and vitamin C, which protect blood vessels from oxidative stress and damage. Healthy blood vessels are crucial for proper blood flow and erectile function. Number 5. Dark chocolate. Dark chocolate is rich in flavonoids, which can improve blood flow and lower blood pressure. Consuming dark chocolate in moderation has been linked to improved erectile function. Opt for high-quality dark chocolate with a high cocoa content to enjoy these benefits. Number 6. Fatty fish. Fatty fish like salmon, mackerel, and sardines are high in omega-3 fatty acids, which can improve heart health and blood flow. Research has shown that omega-3s can help reduce the risk of ED. Include fatty fish in your diet at least twice a week for optimal benefits. Number 7. Berries. Berries, including strawberries, blueberries, and raspberries, are rich in antioxidants and flavonoids that can improve blood flow and reduce inflammation. Studies suggest that regular consumption of berries can help combat ED. Enjoy them as a snack, in smoothies, or added to your breakfast. Number 8. Leafy greens. The benefits of nitrate-rich vegetables are impressive. Leafy greens like spinach, kale, and Swiss chard are high in nitrates, which can improve blood flow by relaxing blood vessels. Incorporating these vegetables into your diet can support vascular health and improve erectile function. Add leafy greens to salads, smoothies, or as a side dish. Number 9. Oysters. Oysters are known for their high zinc content, which is essential for testosterone production and sexual health. Studies have shown that zinc deficiency can contribute to ED. Enjoy oysters as an occasional treat to boost your zinc intake and support hormonal health. Number 10. Nuts and seeds. Nuts and seeds, such as almonds, walnuts, and pumpkin seeds, are rich in L-arginine and healthy fats that can improve blood flow and support erectile function. Incorporating these nutrient-dense foods into your diet can help combat ED. Enjoy them as snacks or added to meals. Number 11. Whole grains. Whole grains like oats, quinoa, and brown rice are high in fiber, which can support heart health and improve blood flow. Studies have shown that a diet rich in whole grains can reduce the risk of cardiovascular disease and improve erectile function. Incorporate whole grains into your meals for sustained energy and health benefits. Number 12. Garlic. Garlic contains allicin, which can improve blood flow and reduce inflammation. Regular consumption of garlic can help improve cardiovascular health and support erectile function. Add garlic to your meals for a flavorful and health-boosting addition. Allicin helps dilate blood vessels and improve circulation, which is essential for maintaining erections. Number 13. Avocados. Avocados are rich in healthy fats, potassium, and vitamins that support cardiovascular health and blood flow. Incorporating avocados into your diet can help improve erectile function. Enjoy avocados in salads, on toast, or as guacamole. The healthy fats in avocados support heart health, while potassium helps regulate blood pressure, both of which are crucial for erectile function. Lifestyle tips that can make a change. Making sustainable lifestyle changes is essential for maintaining and improving sexual health. Let's explore practical tips for long-term success. Number 1. Develop and maintain a regular exercise routine. Regular physical activity is crucial for overall health and erectile function. Exercise improves blood flow, reduces stress, and boosts cardiovascular health, all of which are important for combating ED. Create an exercise routine that includes aerobic exercises, strength training, and flexibility exercises. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming. Include strength training exercises like weightlifting or body weight exercises at least 2 days a week. Flexibility exercises such as yoga or stretching can help improve overall mobility and reduce muscle tension. Find activities you enjoy, whether it's dancing, hiking, or playing a sport, to stay motivated and consistent. Number 2. Incorporate ED-friendly foods into your diet. Adopt a balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Certain foods are known to improve blood flow and support cardiovascular health, which can help reduce the risk of ED. Foods rich in nitrates, such as leafy greens and beets, can improve blood flow by relaxing blood vessels. Antioxidant-rich foods like berries, dark chocolate, and citrus fruits help protect against oxidative stress and inflammation. Omega-3 fatty acids found in fatty fish, nuts, and seeds can improve heart health and circulation. Limit processed foods, sugars, and unhealthy fats to maintain optimal health and support erectile function. Plan your meals around these nutrient-dense foods and enjoy a variety of colors and flavors to keep your diet interesting. Number 3. Address psychological stress through counseling or mental health therapy. Psychological factors like stress, anxiety, and depression can significantly impact erectile function. Chronic stress increases cortisol levels, which can interfere with the hormonal balance needed for sexual health. Seek professional counseling or therapy to address these issues and improve mental health. Cognitive behavioral therapy, CBT, has been shown to be effective in managing stress and anxiety. Incorporate relaxation techniques such as mindfulness, meditation, and deep breathing exercises into your daily routine to manage stress. Mindfulness practices can help you stay present and reduce negative thinking patterns, while meditation can promote relaxation and mental clarity. Deep breathing exercises can activate the body's relaxation response and reduce tension. Number 4. Maintain a healthy weight through diet and exercise. Maintaining a healthy weight is essential for reducing the risk of ED. Excess weight can lead to cardiovascular disease, diabetes, and hormonal imbalances, all of which contribute to erectile dysfunction. Achieve and maintain a healthy weight through a balanced diet and regular exercise. Focus on portion control, nutrient-dense foods, and physical activity to support weight management and overall health. Monitor your calorie intake and make adjustments based on your activity level and weight goals. Choose whole, unprocessed foods that are high in nutrients and low in empty calories. Regular physical activity, including both aerobic and strength training exercises, can help burn calories and build muscle, supporting a healthy metabolism. Number 5. Limit alcohol consumption. While moderate alcohol consumption may not harm erectile function, excessive drinking can lead to ED. Alcohol can depress the central nervous system, affecting the signals needed to achieve and maintain an erection. Stick to the recommended guidelines of no more than 1 drink per day for women and 2 drinks per day for men to avoid negative effects on sexual health. Choose alcohol-free days each week to give your body a break and reduce the risk of developing a dependency. Reducing alcohol intake helps maintain proper neurological function and vascular health, both of which are critical for erectile function. Number 6. Quit smoking for improved blood flow. Smoking can damage blood vessels and restrict blood flow to the penis, leading to erectile dysfunction. Quitting smoking is one of the most effective ways to improve erectile function and overall health. It can lead to better cardiovascular health and enhanced blood circulation, directly impacting erectile function. Seek support from healthcare providers, smoking cessation programs, or support groups to help you quit smoking. Explore nicotine replacement therapies or prescription medications to reduce withdrawal symptoms and increase your chances of success. Quitting smoking restores blood vessel health, which is crucial for maintaining adequate blood flow for erections. Number 7. Manage stress through relaxation techniques. Stress can significantly impact sexual function by increasing cortisol levels and reducing sexual desire. Incorporate stress management techniques like meditation, yoga, and counseling into your routine to reduce stress and improve ED. Regular practice of these techniques can promote relaxation, reduce anxiety, and enhance overall well-being. Mindfulness practices can help you stay present and reduce negative thinking patterns, while meditation can promote relaxation and mental clarity. Deep breathing exercises can activate the body's relaxation response and reduce tension. Effective stress management improves mental health and hormonal balance, positively influencing sexual function. Number 8. Consider herbal supplements. Certain herbal supplements such as ginseng, ginkgo biloba, and L-arginine have been shown to improve erectile function. These natural remedies can support blood flow, reduce oxidative stress, and enhance sexual performance. However, it's important to consult with a healthcare provider before starting any new supplements to ensure they are safe and appropriate for you. Some supplements may interact with medications or have side effects, so professional guidance is essential. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.